I actually met my future employer at an AOHC meeting when I was a resident. I didn't know she would be my employer one day, but I did have my first interaction there.
I've done a lot of certifications, and so going to the medical review officer certification, learning about federal drug testing, and really having your time with the trainer to ask your questions, I think that was particularly beneficial. It's one thing going and sitting in a conference and having a lot of information presented to you that can be useful, but having the time to actually meet with the trainers for those sessions, the professors, the experts, and really asking questions to help you understand the application of that information is critical.
There's so many things that you learn at AOHC. It's kind of hard to pin down any one thing, but there are hundreds of pearls that we've picked up over the years that have made a huge difference in practice. Some of the things are even the OSHA updates, just knowing how to talk to companies about why you should do things the way you're supposed to do for different OSHA standards, because a lot of them don't understand the basis for it or how to do it right. And so just learning those kind of things makes a difference.
A couple of years ago, there was a late-breaking session where they talked about H1N1, and I attended, and I was able to take back to my practice important, relevant information regarding preparedness, and we were able to implement that throughout the services as important planning guidance.
Many years ago, when I was first starting out in occupational medicine, one of the presidents actually came up to me and asked me to volunteer for a committee. And I said yes. And that saying yes really opened a lot of doors for me, got me involved in ACOM leadership, and it's been a very rewarding career ever since.
AOHC gave me the opportunity to interact with someone who does their work primarily internationally and primarily in Germany, and I learned a lot from that session, and it really helped develop a program that was local in California and had ramifications around the U.S. So if it wasn't for AOHC, a conference like that, which draws not only national attendees but international attendees, I wouldn't have had the opportunity to work with that individual. So that's something that I really value, the ability to work not only with local and national experts but also international experts.
When I joined the ACOM earlier, I was a simple member coming in and in awe, basically seeing all this event occurring. What really guided me was the recent president section that allowed me to be involved at the level where I understand how the ACOM works.
At the conference in Chicago, I attended a lecture about orthopedics. Prior to that conference, I had not used orthopedics much in my practice, but I had a different job at that time, and it was really beneficial in updating me on what I needed to look out for patients.
At the 2014 AOHC, which was in my city of Baltimore, I was on the planning committee, and I got to cut the ribbon to allow people to enter the exhibit hall. And what made that very special for me is that I got to cut it with Mike Levine, who's another member of our planning committee, and we're both on the planning committee back then. But more than that, he and I were co-chief residents together about 15 years before we cut the ribbon. So for me, that was really cool to be able to cut the ribbon at a meeting, and realize that I'd been coming for 15 years and cut it with someone that I'd known for that time and grown up in the specialty with.